We have some patients who come for workout and they do have anxiety. Some have anxiety and panic attacks.
So there is a connection from your gut to brain. The scientists call it as gut-brain axis. Depression, anxiety, all this you can connect it to a neurotransmitter or a hormone called as serotonin. We call it as happy hormone. 90% of your serotonin is produced from your gut. There are people with gut issues who cannot form serotonin.
Social media and also work, we do a lot of work on phone. So all the time our hand is in this position. So we have so many patients of carpal tunnel.
Nutrition plays a huge role in carpal tunnel syndrome, especially vitamin B12 because your nerve is trapped.
When I ask him questions, sir, can I take this? Then he will ask me, why you want to take? And I am excited to take something and he will ask me a couple of questions and I'm like, okay, my excitement is gone.
People tells like everybody take probiotic, it's good for your gut. Take prebiotics, it's good for your gut. It's not at all probiotic supplements will help.
Right.
There are people who get worse when they take probiotic supplements. Vegetarians have a tendency to lack certain vitamins like B12 and even protein intake is less. And protein is less, they will have less collagen production in their body. So less collagen, you are more prone to get degenerative changes very fast.
So if there is a digestive issue and they are taking protein shakes and collagen as a supplement, still their collagen will not be absorbed.
It might get absorbed, they don't get the proper benefit out.
Right. Prebiotic fibers, what does that mean?
When we tell people to eat fibers, they eat lots of rice or chapati thinking that they are fibers. They are good in fibers, but they are called as insoluble fibers. A good bacteria in the gut cannot eat these fibers. They need a specific type of fibers called as prebiotic, which is a fermentable fiber.
Hi, I'm Dr. Drashti and I have a YouTube channel. You are following it. And I thought that I want a more holistic approach to my patients and to give you on the YouTube. I'm starting the podcast and my first guest is Dr. Vishnu. And he is a low dose medicine specialist and he's one of the few functional medicine experts in India. This is Dr. Vishnu. I met Dr. Vishnu around 2016. And I was looking into a lot of, websites and Instagram and all about functional medicine and it always attracted me. And I always saw that the root of lot of disease were in the gut and we were treating more of root cause when we are talking about Ayurveda or naturopathy. My mother and my mother-in-law used to always say कि कोई भी चीज़ हो, सर भी दर्द करता है, घुटना भी दर्द करता है, पेट का प्रॉब्लम है. I did not believe because I was a hardcore scientific person. But when I went deeper into my education, plus I went deeper into my patients where I used to use the scientific things which we were taught in medical schools. And it was not working on all patients. So then I found when I was talking to Dr. Vishnu and he would just without any attachment, he would just give me any one or two advice for any particular patients I would call, and right away within a week the patient gets better. And I used to call him every time and he just without any expectation he would answer me whatever he had in mind. And since last 3 years Dr. Vishnu is coming to Vadodara every month. And he already in 2 to 3 days, he sees so many patients and we have the most critical patients, right, sir?
Yes.
And we both love that we have the most critical patients and a lot of doctors who come and trust us. We are very grateful for that because what happens that even though we have a naturopathy and Ayurveda and functional medicine approach, it is scientific and it is not generalized. And it is a particular approach for that particular patient. And that's why all the doctors also started trusting Dr. Vishnu. So thank you very much for being here.
Thank you for that introduction, ma'am. And I'm so happy to be here today with you in this podcast session.
Few specific patients I wanted to talk was gout patients. Where people come with a big toe or elbow or finger pain. And it is such a small area that even ultrasound and IFT, certain machines don't work. It has to be mostly ice and laser if you have. So it becomes dependent on the physio treatment. Some acute inflammatory gout, we cannot even prescribe exercises. So there is something inside which is bothering the joint. So I don't want to always give outside treatment. So what do you want to say about, sir?
So I would like to give a clarity about uric acid and food here. That gives answer for this question. Because most people think that uric acid increases when you eat protein rich foods.
Yes.
That's not 100% true always. It's not all the protein rich food would increase uric acid. There is a specific group of amino acid or protein called as purine.
Okay.
And when you eat too much of purine and when you're genetically prone to this condition, okay, then you might end up in high uric acid level and it can cause joint inflammation. That is definitely one cause. But there are people who don't eat too much of purine or protein in the diet, still they had lots of high levels of uric acid. This is where Ayurveda or naturopathy has got lots of importance.
Answers.
Because uric acid can even increases if you have got a gut issue. Something called as gut dysbiosis can increase uric acid.
Uric acid.
Example, there is a bacteria called as E. coli. It's a commensal bacteria. It's there in everybody's gut. But sometimes when it is in the wrong position in our gut, or sometimes when it grows too much in our gut, it can secrete certain toxins called as Shiga toxins.
Oh wow.
So your uric acid would parallelly increase as a response to this Shiga toxin. So even if you don't eat protein or purine, it doesn't matter. If you have a bad gut, if you have got some bad gut bacteria, you will have high uric acid levels.
Okay, yes. So when I have sports person or people who have very low muscle mass and they want to build muscles and they also have uric acid issues and they also have gut issues, and that's why they have hormone disorder and then they are not building muscles. So for them, you are suggesting that even if they eat, they do not eat protein, they can have issues.
Yes, definitely.
Okay, then for those kind of patients, what should we do?
There again, the Ayurveda or naturopathy become very important. So in those patients, we generally go for a gut detox.
Okay.
Or we can tell we will use certain herbs, even certain probiotics or prebiotics, which has the ability to detox or clean this excess bacterial growth.
Okay. And we should continue doing exercises and physiotherapy while we are doing detox.
Definitely you can. That's fine. That's okay. But you are addressing the root cause by eliminating this bacteria. So once this bacteria is eliminated, then sometime you will be able to eat even all types of foods and still you will be normal.
Okay. So for people with uric acid and gout symptoms with joint pain, when there is acute inflammation, you should not be doing exercises. You should be resting it out and apply ice. If it's a larger joint, then nice hot shower does make a difference. But these are all symptomatic treatment. Even when I give laser and when I do very gentle exercise, it helps to reduce the joint inflammation because exercise will drain joints out. But still the root cause is living in your body. So I would suggest that along with your physiotherapy practices, we should do the gut detox and it should help people, right?
Yes. So it should be always a combined approach. Holistic approach. We can combine physio, we can combine Ayurveda and naturopathy together to bring out the best results for uric acid patients.
Okay, great. So what about the patients who have joint aches and pains, not uric acid but rheumatism? For those people, what do you suggest?
Yes. So rheumatoid arthritis. There are so many people who are affected with rheumatoid arthritis and it's an autoimmune disorder. And everybody know what is autoimmune disorder. Your own body cells are attacking our own tissues. So there is a miscommunication happening in the body. And Ayurveda has told, like years back, they have called rheumatoid arthritis as Amavata.
Okay.
Ama means it is digestive toxin. Vata is like in joint inflammation.
Okay.
So this joint inflammation or your joint diseases is actually originated because you have got poor digestion or you have got your waste which is created after good digestion is not excreted very well. So they builds up as armor. And now scientifically it is, the functional medicine call this concept as leaky gut.
Okay.
When you build up these toxins in the gut, they might enter into the blood and affect your joint tissues. So sometimes it affects the joints and result as rheumatoid arthritis. Sometimes the toxins can affect the skin, leads to conditions like psoriasis, eczema, dermatitis, urticaria, etc.
But the root cause is in the gut. So you have to take a detailed history before you plan to treat.
Yes, and majority of patient with autoimmune disorder has a history of constipation or a bad, gut health.
Right, like bloating and acidity.
Acidity.
Or hypo or hyperacidity.
Yes.
Okay, so for these rheumatism patients, what I see is they have a huge thick file. They are taking medication since a very long period of time. Some people have no pain, and luckily we are able to do exercises with them. But some patients do have similar kind of medications, but they still have severe inflammatory issues.
Yes.
So anything you suggest for them?
Yeah, because the trigger is not addressed. They are on steroids or they are on painkillers, which is helping them to subside the pain. But the trigger, why that joint is continuously getting attacked, why that joint is inflamed, that root cause is not addressed.
So even if they are taking medications and they are painless, still the root cause is not
addressed.
So the joint damage is still happening.
Still happening, and they will not realize it because they might be on heavy dose of painkillers.
Right. So for them, what do you suggest?
So we have to, again, I would come back to the gut approach. So we will have an approach in functional medicine called as 4R approach. So we remove unwanted, or we remove the food allergy or food intolerance, whatever they have it in their body. And we slowly start to repair the gut lining so that leaky gut can be stopped.
Right.
Then we will start reintroducing and reinoculating the good bacteria or the digestive enzymes they lost from the gut. We will introduce it back naturally through using herbs or probiotics. And we fix their gut in a long term so that even the inflammation or the root cause trigger goes away. So that they can maintain, if they maintain a good lifestyle and a good gut health, they'll be able to get off their medication, or they can maintain a pain-free life for rest of their
Right, for as long as possible. So they will have to remain in certain, if there are foods still which is triggering and they have genetic history, then you suggest that they should be off the allergic or intolerant foods.
Yeah, so we'll have two types of approaches here.
Okay.
So we have even cases where we keep the food away completely, like we take off gluten, we take off milk products, or sometimes they might need to avoid group of vegetables called as nightshade vegetables.
Right.
So we'll take it on. But we have seen some people, after their gut is fixed, they're able to eat back even, small amount of gluten or even some vegetables or even non-veg. They're able to, they're comfortable even after eating non-veg. They don't get any triggers. So there is two types of approach, but again, that is specialized.
Personalized. You have to have a personalized approach. The sessions which I do on the podcast, even if the sir is speaking, it is general for information. When it is personalized, it just hits the root cause and the issues are gone. Right, sir?
Yes.
Okay.
Because every body is different.
It's different.
So we cannot generalize a treatment for everybody. It's not like a paracetamol that you take for fever for everybody. No, it doesn't work like that.
Right. So for RA patients, I, in short, would say that if you are symptomless, still see that are you hitting the root cause? Are you looking for something? What is your trigger? Or are you still taking medications and you don't know what the medications are doing? Or sometimes you don't know what the immune system is doing to you. But I would still suggest some regular exercises and connect with your naturopath if you are in touch with the person. And if you have inflammation, acute inflammation going on, then I would definitely suggest that you should hit the root cause, even if the medications are not working. So look for the right treatment. So one other common nowadays patients I see, because of a lot of usage of phone and social media and also work. We do a lot of work on phone. So all the time our hand is in this position. So we have so many patients of carpal tunnel, and we do give lot of exercises to carpal tunnel patients once the acute symptoms are gone. But there are 20% patients who don't get better. So what do you suggest for in general carpal tunnel?
Yeah, of course, like postural correction or whatever the exercise is very important. But I would add few points like nutrition. Nutrition plays a huge role in carpal tunnel syndrome, especially vitamin B12, because carpal tunnel syndrome is a condition where you have got pain in your wrist joint because your nerve is trapped.
Right, median nerve.
Yes. So you have certain nutrients which helps you to relax that, the nerve. Yes. Especially vitamin B12, very important.
Okay.
And B12 deficiency is very common nowadays because if you have any gut issues, there is chance that your B12 absorption goes slow. And the second vitamin would be B6, vitamin B6. So people with carpal tunnel syndrome or nerve-related issues, it would be best if they can add these two nutrients or vitamins in their food, or it would be good if they can add it as a supplement, at least for a short time.
So B12, I think very commonly people are taking. I'm not aware of B6 if it is individually coming or should they take in a B complex situation.
Better if we can do it in an individual B6 supplementation. There is an active form of B6 called as P5P, pyridoxal 5-phosphate.
Yes.
And carpal tunnel is more commonly seen in females.
Right.
And females usually tend to lack B6 nowadays. That's a common trend seen. And B6 deficiency is strongly related to premenstrual symptoms, which is very common in young females nowadays.
So if they have hormone irregularity, they can have it?
Yes. And low vitamin B6, females are more prone to get low progesterone levels, which can affect their fertility.
Wow.
B6 deficiency cause hair fall. B6 deficiency cause mood swings. And nerve health is badly affected. So for female, that is a beautiful, vitamin that every female should
be taking.
Yeah.
I'll add in to my list.
Even it helps for females above 40 plus because it supports their menopausal stage, everything.
Like nervous system wise.
Nervous system.
And hormones also.
Yes.
Okay. So coming back to carpal tunnel, what I would do is when they have severe acute symptoms, I give gentle mobilization and the physiotherapy treatment according to the patients I see. It is personalized again. And for patients who start getting better, then I do a lot of exercises to release the nerve, neurodynamics technique, and I would add B6 and B12 from now on. So the treatment time is shorter and the patients get better faster.
And nutrition, when it combines with exercise together, and if it is the right nutrient, it brings amazing changes in a very short time.
Okay. So coming to pain again, I would also like some inputs for osteoarthritic patients because I've seen there are many people who have degenerative changes in the joint, but they did not, like if I'm talking about my grandparents or my in-laws and a lot of other people who are older generation, and they did not eat out too much. They were not into bakery or overeating. And even though they have degeneration, they will not have severe osteoarthritic symptoms. But I have seen in their x-ray that there are changes. But nowadays, the OA patients are increasing like anything. So what do you suggest for them?
So nutrition is definitely again a crucial role here because I would tell people eat less protein nowadays. And if we take the vegetarians,
Right.
Vegetarians have a tendency to lack certain vitamins like B12, and even protein intake is less when you compare to vegetarians. And protein is less, they will have less collagen production in their body. So less collagen, you are more prone to get degenerative changes very fast.
Okay.
And third, B12, it's very difficult to get B12 in a vegetarian or a vegan diet.
Okay.
So when you have low protein, low vitamin D, again, vitamin D, it's common even in non-vegetarian. It's not that just vegetarians, that most of the people has D deficiency. First reason, nobody is exposed to good amount of sunlight. Second thing, there is a tendency or there is a condition that called as vitamin D resistance.
Vitamin D
Resistance.
Never heard of that.
Yes, even people take it in the supplements form or something, they may not absorb it very well. There are different reasons for vitamin D resistance, but so that's something that you all should understand. Even if you take it in the supplement form, there might be a chance of that it's not absorbed, it is resisted.
Wow.
So you need to treat the vitamin D resistance as well. So there are people who take high dose of vitamin D and they repeat the test and it would hardly increase 10 units or 15 units. So that, these all are kind of vitamin D resistant.
Right. There are patients who are taking vitamin D for a long period of time, and when they go for blood test, their vitamin D is like 10 or 15 or sometimes 7 or something. Okay. So for osteoarthritis, we have to see that along with exercises and whatever we are doing as physios, you will have to look into nutrition also for inflammation, but also for collagen. So what would you suggest for these people? Collagen.
Improve the protein intake.
Okay.
But before that, I would tell fix your digestion. Because for protein to get properly digested, you need stomach acid.
Right.
And people with gut issues, there are lots of people with low stomach acid production. So you cannot digest protein. And your protein is not digested, the collagen formation is not proper. So fix your digestion and then improve the protein intake. You can take lots of, even pulses is a good source of protein. But there are many people who tells when I take pulse, I get bloat.
Yeah.
There are plenty of tools. So fix your digestion and naturally it will naturally helps to improve your collagen production.
Okay.
And add more of vitamin C. Vitamin C improves your collagen.
So if there is a digestive issue and they are taking protein shakes and collagen as a supplement, still their collagen will not be absorbed.
No, it might get absorbed, but they don't get the proper benefit out of it. Yeah.
So for people who are taking protein shakes and collagen or taking high protein but they have low stomach acid, their collagen or protein will remain undigested and it will just bulk you up and give you other issues rather than actually hitting your body and making good cartilage, hair, skin or muscles. So first get your stomach acid also checked, right?
Yes.
So I remember when we first met and I had somebody who had really high acidity and you gave us a test to check the test. Whether you are high stomach acid or low stomach acid. And I knew that there are people, like even before I met you, that there are people who are taking antacids and they had really bad problems because of the antacids or because they were trying to just eat ice cream and reduce their stomach acid or feeling of the stomach acidity. They did not absorb food well and they still kept on having gut issues and joint issues. So, which is the test, sir, would you recommend at home?
It's a simple test that everybody can do it in home is called as baking soda. Baking soda testing. So, take 1/4 teaspoon of baking soda, put it in 30-40 ml water and drink it in empty stomach.
Okay.
So, when you take it in empty stomach, naturally this condensed in baking soda should mix with the stomach acid and you should burp.
We should burp.
And you should burp within 4 to 5 minutes.
Okay.
So if you burp in 4 to 5 minutes, that means you have
good stomach acid.
Good stomach acid. If you don't burp, that is we consider that the patient might have low stomach acid, but definitely we correlated with few blood markers, correlated with digestive systems to confirm that patient has this.
Their history and everything.
Yes.
Right. But this is a nice test and I have used it. And thank you for telling us that. So there are a lot of clients as when they come for nutritional advice to me, they are talking about migraines. And they are all mostly told that because of their acidity, there is migraine. So can you just shed some light on it?
Yeah, migraine it's a very bad condition and people who suffered from migraine would understand how intense it is. Migraine usually we classify into 3 types. It can be gut related, like acidity and migraine, definitely there is connection. And there are papers saying nowadays that H. pylori, a bacteria called as H. pylori, which cause acidity,
Okay.
can cause migraine.
Migraine.
So treating gut, it's important in migraine. That's one type classification. Second, we have there are females during ovulation period who gets migraine issues. And third, nutrition and migraine is also connected. Like magnesium, it's a very crucial mineral in nerve health. So there are people with magnesium deficiency who gets migraine bugs.
Okay.
So there is 3 classification, and gut is very crucial, and H. pylori is a root cause. One of the root cause which we can link to migraine and gut.
So when you have a patient, it can be generalized that okay, start taking magnesium and then do this for acidity and your migraine will be gone. Should we take it that way, or it is personalized?
No, not general. Of course, it is personalized. There are people who have gut issue and hormonal together.
Both.
So it always depends on the personalized case history taking that we would come to a conclusion of these are the factors that we have to treat in a migraine patient.
Okay.
But as simple advice, one of the best, easiest technique to treat migraine, there is a herb called as black cumin, Nigella sativa. Black cumin has a capacity to treat H. pylori. It reduces H. pylori load in the human gut.
Okay.
So people with migraine, people with acidity and migraine, they can just crush some black cumin, add it, mix it with some organic honey, and take it after food once or twice a day. That will solve the gut issue which is linked to H. pylori and helps to fix the migraine also. So it's a general tip that people with acidity and migraine do it.
Like at home, your own remedy.
Yes.
So how long would they take?
We can do, it's a food, it's a simple simple technique. You can take it up to 2 to 3 weeks or up to 1 month. It's
Or whenever you feel that there is like somebody feels that after 3-4 months, if the migraine is coming back, they can try again.
Yes, sure.
Okay, but so with black cumin, H. pylori will go.
H. pylori load will reduce back.
Okay, but it is when it is too bad, they need help.
Yes,
Externally.
definitely.
Okay.
And taking good amount of probiotics, maybe in the form of food, it can be good quality of yogurt or some fermented foods can also help with the migraine, because probiotics again reduces H. pylori load. So you can include lots of probiotic rich foods in your diet.
Okay. You said about magnesium also.
Yes.
So how do we add magnesium in our...
Magnesium, it is better to be added in supplement form. There are different types of magnesium available. Like you have magnesium citrate, you have magnesium glycinate, taurate.
Right.
So each type of magnesium has different benefits.
Okay.
Example, a person with constipation would get benefit with magnesium citrate. A person with lots of muscular issues or muscle cramping or muscle pain, magnesium glycinate will be a better form.
Okay. So I myself had just taken, because my daughter had brought magnesium citrate. And I just started taking it because I love to take a lot of supplements. And I started taking, and it did improve my gut health a lot. I mean gut health as in emptying my bowels.
Yes.
I really... Sometimes if I don't take, I miss my magnesium citrate, but I don't want to be dependent on it because I want to be dependent on my bowel movement. So I consult Dr. Vishnu and I get better with that.
Yeah.
And
one point with magnesium, like since we have already spoke about acidity,
right.
Magnesium can help with acidity also, because it's a muscle relaxant. So people who get lots of severe acidity attacks in the night, especially when they take magnesium supplement, it helps their lower esophageal sphincter to get relaxed.
Okay.
So when your lower esophageal sphincter is working properly, the acid cannot reflux back to your mouth. So it's prevented.
It's closed.
So magnesium is good for your acidity symptoms as well.
So I do have patients with cervical headaches also, but that is different than migraine, right?
Yes.
Because cervical headaches, if you want to check yourself, then it comes with when you start having neck pain, and then when you have upper cervical issues and this muscle and the fascia which are going all the way here, if they are affected, then they start having that specific way of headache. Whereas migraine is related to gut and hormones and acidity. So you will have difference in that symptom. And I've seen that when I start mobilizing the upper cervical joints and I do some fascial maneuvers on the head and all, release the jaw and their cervical headache is gone. So along with my mobilization, along with certain releases, fascial maneuvers, I will start giving them magnesium glycinate to help them, or magnesium citrate. So we have some clients actually, who come for workout, and they do have depression like symptoms, and they do have anxiety. Some have anxiety and panic attacks. So do you have something to say about it?
Yeah, so again, nowadays there are lots of researches focusing on gut health related to the mental aspects, or gut and mental health. Okay, so there is a connection from your gut to brain. The scientists call it as gut-brain axis, and it is related from your brain to gut also.
Okay.
So depression, anxiety, all this you can connect it to a neurotransmitter or a hormone called as serotonin.
Serotonin. Yes.
We call it as happy hormone.
Okay.
And the 90% of your serotonin is produced from your gut.
Okay.
And once it is formed from your gut, then it is taken to the brain. So that it reaches the brain and act in brain cells, so that you are happy, you feel happy, or you feel good. That's why it's called as your happy hormone.
Okay.
So there are people with gut issues who cannot form serotonin.
Okay.
So because they don't form serotonin from the gut, they lack serotonin action in the brain also. So naturally it leads to depression. So the gut is a cause for depression as. Okay. So we have to work on their gut and improve the serotonin production naturally, so that it is transported to the brain and their anxiety, depression can be correct.
Right. So sir, how can you improve your serotonin level naturally?
So we need good bacteria. Okay. We need some nutrients. This combo will help to improve the serotonin, and even some prebiotic fibers. So I would recommend the probiotics with lactobacillus groups, especially lactobacillus reuteri. That's one of my favorite probiotic, because even it helps to treat depression in some cases.
Okay.
So I will use lactobacillus probiotic. I would give the clients to eat more of prebiotic fibers. Okay. Like inulin or gum arabicum, these types of prebiotic fibers. Okay. And give them good nutrients like B6. So when these are the raw materials that you need. Okay. And when you have got good bacteria with this raw material, they produce serotonin. And serotonin can also cause constipation.
Okay. High serotonin or low serotonin?
Low serotonin. Because one function of serotonin is to mobilize the gut, especially the small intestinal area. Okay. So you need vagal nerve support and serotonin to mobilize small intestine. And you need bile acids to mobilize large intestine. So serotonin is very important. If you don't have serotonin, there is a chance you get constipated.
Okay, so prebiotic fibers, what does that mean?
So people eat rice. Like when we tell people to eat fibers, they eat lots of rice or chapati, millets, thinking that they are fibers. They are good in fibers, but they are called as insoluble fibers.
Okay.
But your gut bacteria, your good bacteria in the gut, cannot eat these fibers. They need a specific type of fibers called as prebiotic, which is a fermentable fiber. These insoluble fibers cannot be fermented. So fibers like inulin, gum arabicum. Inulin, you have it in onion. Okay, good. That's a good source of inulin. So these are the fibers which your gut bacteria will ferment, and they use it as their fuel.
Okay.
So
which is the other one you said?
Gum arabicum, gum acacia.
How do we get?
We have it in supplements form. That's the best way to consume gum arabic.
And what are the other prebiotic fibers in food?
So you can eat lots of artichoke. As I mentioned, onion, garlic carrot has got good prebiotics.
That's why people make onion garlic tablets, and that's why people with onion garlic who are taking, they have lesser issues in the joints. That's what I've seen.
Yes. And even gut.
Right, that's what.
And garlic is a good antifungal. So I have seen people who take garlic as supplement. In supplement form, it has a content called as allicin. It's a natural antifungal to the gut.
Okay.
So when they take allicin supplement, the dandruff reduces. Because you develop dandruff or you develop seborrheic dermatitis because you have fungal overgrowth in the gut.
Okay.
So when you take allicin types of class of supplements, you are actually cleaning the fungus from the gut and helping your dandruff to get cleared. And treating dandruff will treat hair fall.
Okay. So does it matter if you cook onion garlic or uncooked onion garlic?
Best form to eat it in the raw.
Raw.
When you chew it, the allicin get activated.
Right.
So raw
Juices which come in our mouth.
Yes.
I feel it is also like, that prickly feeling you have when you eat onion.
Yes. That
That is
pungent.
also pungent. So it's a very lot of good tips we got. But I also at my place also I make sure that when my team comes up with this idea and when also my therapist also come with the idea that we can also put something which has million views, that do these 5 exercises and you have 6 packs abs, and do these 10 exercises and your ACL will be like this, or do this and you will have this. And I know that it does not work. I don't want to cheat my clients or misguide my clients. And I now, while talking to Dr. Vishnu, I can see that he will not give a general advice. I've seen that. He's very specific. He comes to Ayush Clairveda. He's a part of Clairveda. And you can take his online consult. You can come and meet him here. And I'm very happy when I talk to him or I get treated by him. Thank you so much for being so vigilant and working in detail. And I've also seen that when I ask him questions, sir, can I take this? Then he will ask me, why you want to take? And I am excited to take something and he will ask me a couple of questions and I'm like, okay, my excitement is gone. It's not for me then.
So that's what people tells, like everybody take probiotic, it's good for your gut. Take prebiotics, it's good for your gut. It's not that all probiotic supplements will help.
Right.
There are people who get worse when they take probiotic supplements. So I believe everybody is different. So you need a personalized, individualized approach. Right. So even if it in the selection of medications, diet, that's why generally I don't tell that, okay, you follow this diet, it will cure your 100 issues. No. I believe what type of health issue you will have to follow a certain type of diet. So it's more personalized approach that I believe more.
So I want to also add into this that I have been sitting in your consulting for a very long period of time with my patients, and I have seen that he does not give diet, but for each particular client, he will write foods which is going to suit and eliminate the food which is not going to suit them. One. Second thing, I was one time amazed that very initial consulting when I was sitting with you, that one time you gave somebody prebiotic, one time he gave somebody probiotic, one time he gave somebody pre and post both, and one time you told somebody that do not take anything related to pro or prebiotic. And I was really like, I am not going to put anything in my mouth before asking Dr. Vishnu. So thank you. And actually I'm put into mouth as in related to bacteria. I used to have kombucha and a lot of stuff. So now I've stopped taking and I always consult him before I take anything.
Thank you so much, ma'am, for inviting me to this wonderful podcast session.